Hi there, my name is Megan Wonder. I'm one of the family nurse practitioner students at Simmons University. I'm here today with Kenneth Morales, otherwise known as Kenny. Kenny, I just wanted to check before I begin this video, do I have consent to record you for the purposes of our health assessment class?
Yes, you do.
Awesome. All right, so today we will be performing a head, ears, eyes, nose, throat, respiratory, cardiovascular, and peripheral vascular assessment. So for our video, I will be using Kenny as our demonstratee. So when we first start an exam, we always inspect a patient. I'm inspecting his head. I notice that there's symmetry. There's no sparseness of hair noted. I note that there's even distribution of hair on the head and on his eyebrows. Eyes are symmetrical. Nose is symmetric. Lips appear symmetric. Ears also symmetric. Everything appears symmetric for the sake of the video. So now I'm just going to palpate his head. What we're feeling for here is any nodules, masses, lumps, any sparseness in hair distribution, but I feel smoothness. I don't feel any lumps, bruises, lesions, masses. Hair is evenly distributed across hair and eyebrows and eyelashes. So we're going to move down to your eyes. I wanted to ask, do you wear contacts or glasses at all?
I don't.
No. And do you regularly see an ophthalmologist, an eye doctor?
Not regularly.
Not regularly. Okay. So we are going to perform for our baseline status an eye assessment for you. So what I'm going to do is I'm going to be performing a few different things. We want to test your accommodation to light. We want to test your peripheral vision. So we're going to start off with peripheral vision. What I'm going to do is take my two hands and they're going to start behind your head. Now, I want you to look at me. When you see these peripherally, let me know, okay?
I see them.
Okay, perfect. You're also now going to stare straight ahead, but I want you to follow with your eyes this fingertip, okay? So follow this finger. Good. And this will test for the 6 cardinal points of view. So now what we're going to do is we are going to test, we're going to inspect his conjunctiva before we fully assess otherwise. So I note that his sclera is white, pupils are round. They are about 3+ for pupil size right now. We are going to pull down on the eyelids to test to see the conjunctiva color. Perfect. So that is white with a little bit of pink, but not too much redness. Do you have seasonal allergies?
I do.
Okay, I wondered. Sometimes that can get a little red because of that. So we are going to take our fundoscope and we are going to examine your eyes. This will test for perla, which is accommodation of the eye with constricting to light. So I'm going to take this. I want you to stare straight ahead at me, okay? This thing, for the sake of the video, does not have a light working, but for the sake of the video, we're going to pretend it does have a light working. So just stare straight ahead at me. We're going to test for your pupils to constrict to light. All right, we're going to do it twice on each side so that we can test for the right eye and then see the constricting of the other opposite eye. All right, so the patient's pupils are equal, reactive, round, and they accommodate to light, and they are also brisk upon examination, which is within normal limits, so that is very good for you. We are now going to move on. I also forgot to mention, but there was no drainage noted, no erythema of the eyes, and now we're going to move on to the ears. So the ears, from inspection, I see that they are a little pink, but I don't see any nodular masses. I don't see any drainage. What I'm going to do is we are now going to pull up and back. I'm going to go on this side for the video so you can view it. For adults, we will pull up and back on the ear. For children, we'll pull down and back. This will just help viewing the tympanic membrane a little bit easier with adults. So for the sake of the video, we are going to use our otoscope, and we are going to use the largest speculum. That way it gives him comfort, but we're not going to shove it into his ear. We're going to very gently place it in. So we're, like I said, we're going to pull up and back. We're going to view the inside. All right. Do you feel any pain at all when I pull back on your ear?
I do not.
Do not. Okay. All right. So from my view, I note that the tympanic membrane is intact. I don't see any lesions or cysts. I also note that there is It is pearly and white and translucent in color, which is a normal finding. I also did visualize the cone of light, which is what we would like to see in a normal ear exam, so that is good. What I'm going to do now, I have a few tests to test your hearing. We're going to test something called the whisper test and then the Ryan and the Weber test. So the whisper test, we'll do that first. What I'm going to do is I'm going to cover one ear at a time. We're going to whisper something and see if you can hear it, okay? So I'm going to cover this side. Now, for the sake of the video, the patient does not have perfect hearing, just as a baseline, but for the sake of the video, just answer appropriately, okay, as you hear it. Apple.
Apple.
Perfect.
Baseball.
Perfect. So the patient did pass the whisper test. We are now going to move on to the Weber and Ryan test. So this tests air versus bone conduction and conductive and sensorineural hearing loss if you have it. So what we're going to do is I'm going to tap this on my leg and it's going to vibrate. And now I'm going to stick it behind your ear on the bone. Do you feel the vibration?
I do.
You do. Do you still feel and hear the vibration here?
I do.
You hear it? Okay. And do you feel the vibration here?
I do.
Good. So you have passed the Weber and Ryan test. This shows that air conduction is greater than bone conduction, which is AC is greater than BC. So air is greater than bone. So you have passed the hearing test within normal range. I will now be moving on. Since we have assessed the nose, I wanted to just kind of review that. We will be assessing his maxillary and frontal sinuses. So we're going to be palpating those. And I know the patient noted that he does have seasonal allergies, so they might feel a little tender. So I'm just going to palpate to see if I feel any tenderness here. Okay. All right. So they are non-tender to palpation. I did not feel any lesions or swelling upon palpation. So now we are going to move on to the lips, the oral mucosa. From inspection, I know that he has symmetric lips. They are dry, pink. I'm going to have you smile for me. All right, I don't notice any missing teeth. I'm going to have you open your mouth, say, ah.
I have the perfect smile, don't I?
You do have the perfect smile. All right, ah. Okay, from inspection, from his mouth open, keep your mouth open for me. I noticed that he has a pink oral mucosa. All teeth are intact. I don't see any leukoplakia on his tongue. So we're going to take a light and shine in his mouth just to see, just to examine it a little closer. So I'm going to have you stick your tongue out for me. Say ah again. Good. Okay. And now I'm just looking at your uvula, which is rising symmetrically. Can you take your tongue and move it from side to side? Good, good. All right. Now I'm going to have you close your mouth and puff out your cheeks for me. Good. All right. So his cranial nerves in his mouth are intact, as he has been able to perform the hypoglossal cranial nerve. He has no exudate within his mouth, no lesions, no masses. His uvula rose midline. It is symmetric. It did not deviate to one side when he opened his mouth and performed for me. I did not know any lesions as well on the underside of his tongue when he moved it back and forth. So right now we're going to start moving down your neck. We are going to palpate for his lymph nodes, and I will read them off as I palpate them. We're just going to turn you a little bit. So we're going to start off, we always start off with the submental. That is underneath the chin. That's only one finger. So we're going to start by palpating that one. So this is submental. Then we're going to move on to submandibular. And then we're going to move on to tonsillar, pre-auricular, posterior auricular, occipital, which I'm going to turn you, is in the back of the head. Good. Now we're going to turn you back. Good. All right. We're going to be doing your superficial cervical, your deep cervical, which sometimes are a little hard to feel. We are going to do your posterior cervical. And then the last one is our supraclavicular, right above his clavicle. All right, so none of his lymph nodes were inflamed when I palpated them. I noted that there was no masses or nodules. They were very non-tender upon palpation as well. So they were within normal range, so that's very good. What I'm going to have you do, we're going to assess your trachea. So we're going to turn you a little bit so they can see you still. Stare straight ahead of the camera. I'm just going to assess his neck. It appears to be Symmetric, I don't see any deviation as of right now. What I'm going to do is we're going to assess his trachea, so you can either do this anteriorly or posteriorly. For my examination, I'm going to do it from the front. So we're going to palpate his trachea. All right, it is midline currently. What I'm going to have you do, honey, sir, can you please swallow for me?
I'm not old.
Can you please
Thank
swallow
you.
for me? Good. And what we wanted to do for that trachea examination and thyroid was to make sure that when he swallowed, it rose up and down. So that rose perfectly. There was no deviation to the midline of his thyroid, which is perfect. So now while we're at his neck, we might as well assist your JVD, which is jugular venous distension. So I'm going to have you turn your head like this, and we would note it right along here in the neck. What we're looking for is to see if it's pulsating at all. So I don't see any pulsations. And while I'm assessing this, this is exactly where your carotid pulse is. So I'm going to palpate. Good. You have a nice, strong carotid pulse. And what we're going to do is we're going to auscultate to hear if we can examine any bruits or thrills. So I'm going to have you turn your head again. Perfect. Awesome. All right, so I have not noted any JVD in the patient, and I have not noticed any bruits or thrills upon carotid auscultation. So we are now going to move down to your shoulders. I'm going to have you shrug your shoulders against my hands. Can you? Perfect. And then I want you to turn your head against my hand, against resistance. So push against my hand. Good. Now push the other way against my hand. Good job. So he's able to push against resistance and turn his head against resistance as well. So we're now going to move down to the chest area, respiratory, cardiac, and then pulses. So from insection, respiratory-wise, I do not notice any respiratory distress. His precordium, the region above his thorax, is rising and falling symmetrically. No physical exacerbations. So what I'm going to do is we are going to inspect that. We just did that. We are going to palpate now to see if there's any tenderness. Do you feel any tenderness when I palpate your lungs? Good. And then I'm also going to spin him around. Not sure if you can see it from the video, but I'm also going to palpate the back of his lungs. And while I'm back here, I'm just going to auscultate his breathing. So Ken, I'm going to have you take some nice normal breaths. Don't feel like you have to take nice deep breaths, just normal ones, okay? Good. Okay, we're going to move you back around to the center so that the camera can see you again very nicely. Now we are going to auscultate the front of his lungs because we just did the back. Now, do you have any difficulty breathing at all?
No. Only when I have bad seasonal allergies and my nose gets really stuffy.
Oh, okay. Okay, all right. So now that we have assessed his respiratory status, we are going to assess for his AP lateral ratio, which can assess to see if he has a barrel chest. We find this a lot in COPD patients. Do you have COPD?
I don't know what that is.
Cardio-obstructive pulmonary disorder.
No, I don't.
Smokers usually get it a lot. People who have lung disorders.
Oh, no.
Okay, perfect. So what you're going to feel me doing is I'm going to have you sideways. And I'm going to take my hands. We're going to test to see the ratio here. All right. So he is within normal range. He is 1 to 2, which is our normal. Ooh, I spun you too much. That is within the normal range. So you have an equal respirations bilaterally. No bruits and thrills heard in your carotid pulse when we auscultated that. Your AP lateral ratio is 1 to 2, which is within normal range. So we're going to move on to our cardiac assessment. we are going to auscultate for all of our cardiac sounds, and I am just going to list them off as I perform them. So as I auscultate, I'm just going to say what they are and where their location is. So we have our aortic on our second right intercostal space. We have our pulmonic on our second left intercostal space. We have our Erb's point at our third intercostal space on the left side. And our fourth intercostal space, we have on the left side, we have our tricuspid valve. And at our fifth intercostal space, on the midclavicular line on the left side, we have the mitral valve. And we're also going to palpate the apex of the heart, and we're going to auscultate for the apex of the heart as well. Okay. Now, I was listening mainly for any murmurs, gallops. I did not hear any when I auscultated, and I was also listening for the S1 and S2 sound, which are the normal heart sounds, the love dub that you hear when the heart beats. So I did hear that. No adventitious sounds noted. Do you have any chest discomfort at all?
No.
No. Okay, perfect. So now we're going to move on to our pulses. So we are going to check out, we already did your carotid pulse, as I've mentioned quite a few times. We're going to start, I'm going to have you hold your arms out like this for me, okay? So we're going to assess for his radial pulses, which are on the outer ends of his wrists. Okay. Now we're also going to feel in his antecubital region, we're going to feel for his brachial pulses. Okay, you can relax your arms. Now I'm going to feel for his femoral pulses, which are right in between his groin region. So we're going to feel them right here. Sometimes they're a little harder to feel. Okay, now we are going to feel behind his knee. We're going to feel for his popliteal pulse. And then last but not least, I'm not sure if you can see, perfect. We have our dorsalis pedis pulse, which is on the top of the foot. There it is. And we have our posterior tibialis, which is on the inside of his ankle. Perfect. So, Kenny, I would like to report that you have equal pulses bilaterally. I have noted no edema, which is swelling. You have very moderate, very good bounding pulses, so that is very good blood flow through your body. Just to kind of summarize, because we have now reached the conclusion of our assessment, I just wanted to summarize what we've done for mine and for your sake, and for the teacher's sake as well, and for anyone else watching. So we have assessed your head, we assessed for symmetry, any drainage, any dysregularities, whatever the word is. We have assessed your eyes. We noted for any drainage, swelling, erythema. We did a accommodation test with the light, and we also tested peripheral gazes with the fingertips. We tested for your hearing with the Rhine, Weber, and Whisper test. We also examined with the cone of light, and we were able to examine that they were there was no inflammation within the ear. We also noted that your nose is symmetric. There's no septal deviation, which could indicate that sometimes it makes it harder to breathe, but you had none of that. We also noted that there was no drainage from the nose, no redness. We noted that your oral mucosa was intact, tonsils were intact as well. Did not notice any deviation with the uvula when it rose and fell. No lesions on the tongue. Or oral mucosa otherwise. We palpated our frontal and maxillary sinuses, as well as all of our lymph nodes in the face and neck and clavicular area. We were able to test resistance of his head and shoulders, and then we were able to assess his respiratory status to discover that he had a normal respiratory finding within normal limits AP lateral ratio of 1 to 2. We also found that he had a normal cardiac assessment with S1 and S2 sounds heard, as well as no murmurs or no gallops. And we were also able to find that he had no peripheral edema noted upon palpation, and all pulses listed were present. Trying to think, and then thyroid. We noted that the thyroid was midline and no deviation to that. Kenneth, do you have any questions for me about our exam?
No. I
No?
don't.
Okay. Well, I thank you for your time, and I hope you enjoyed our exam. My name is Megan again, and this is Kenny.
Thanks for watching.